my friends. So, yesterday night actually, we landed in Delhi, and immediately I developed a throat irritation. This frequently happens to me every time I come to Delhi. And, being partly a doctor myself, I tried to self-diagnose. I came to the conclusion that it's the pollution, of course, and the dust. And probably because my history tells me that I'm a suspected mouth breather, that's probably the reason why I'm getting this throat irritation. But wouldn't this have been so amazing if it would have taken me hardly a second to just go online or on my app and consult a doctor right there? So that is the power of technology actually in revolutionizing healthcare in India. And let me just give you a brief overview of that. So India is going online, right? And this is why you should pay attention. So in 2008, India, which is the red line, we had barely just begun. And we had US and China who were much ahead of us. And in fact, China had almost reached at the level of US. But India was lagging far behind. So where do you think this has come in 2015? Well, India is as much as the US now. And what about the next few years? Well, we are expected to reach almost 500 million people who will go online. That's me and you, that's the patients out there, that's everyone, each one of us. And what are these people doing actually online? And what is the persona of these people who are going online so rapidly? Well, 65% of these people, which is more than half, they're actually younger than 35. Probably your patients for life. So out of 500 million, almost 300 million people will now be going online and they'll be your prospective patients. And 1 crore new people seeking jobs, of course, chronic diseases, lifestyle, everything will come into play now. And what can you do? What can you do about this? Well, let's see how healthcare is going digital. So 1 in 2 patients actually are searching online either for reviews of healthcare products or for hospitals or for more medical care. In fact, online appointments save at least 8 minutes of time, scheduling time per patient, which is a great saving. And we have almost 250 million downloads of health apps that people have downloaded for their own personal use. And don't think social media is a very flaky, superficial, private affair. There were 44 million tweets about cancer in the last year. So this is what patients are doing. And what about doctors? Doctors are not lagging far behind, of course. So almost all doctors see clinical benefits from digitizing their medical records, which is going digital at the point of care. And they even find it profitable, cost-effective. And in fact, 70% doctors report that they've reduced medical errors because they're using technology in their practice. Now, that's a really great improvement in the kind of practice that you're doing. And if only technology can do it, why not go ahead with it? So what about India? That was the worldwide scenario. In India, actually, we've seen almost 2 lakh doctors who are online on Practor.com. They get about 40 million appointments every year. And there's been a 50% increase every year in this number. So you can clearly see that patients want to go online, doctors are online. And what are the doctors doing online? They're creating over 3 crore electronic medical records, which are managed by us. Over 15 lakh e-prescriptions, which are created. And lakhs of digital bills. Of course, that's a critical component of going digital. And this is the digital healthcare hyperloop, actually. That's how we see it. So starting from the top, patients will book an online appointment. They'll get a notification on their phone to direct themselves to the clinic. Then they'll register at the clinic. The digital medical records will be created by the practitioner or by the support staff. Then they'll finish with payment. They'll go back. The doctors can actually gather feedback about the experience, their billing experience, reception experience. Patients can then consult digitally, on their mobile phone, and finally book another appointment and get back into the hyperloop. And we at Practo, we are proud to say that we are the world's first closed-loop healthcare network where we're completing this whole hyperloop. But what is the most important part of this hyperloop? Well, the most important part of it, which is in your control, is creating the digital medical records. Now, this is the single most important point of entry for the patient into the ecosystem, where at the point of care, their electronic medical record is created by the doctor himself. So they don't have to bother about paper, they don't have to store their prescription with them, they don't have to keep it safe because it's all digital and it's all available online for anyone to use. And why EMR are important? In fact, that's a very critical question right now. So in India, actually, we have the lowest IMR and MMR, infant and maternal mortality rates compared to any other BRICS nation. In fact, forget BRICS nation, we are 7 times as high IMR and MMR as Thailand. And even malnutrition rates are pretty bad, 22 times higher malnutrition than Brazil, which is very stark. It's one end of the spectrum. And on the other end of the spectrum, we have NCDs and we have lifestyle disorders, and we have an epidemic of diabetes. We have so many preventable deaths which are occurring every year only due to ill treatment or lack of awareness about NCDs. So these are the two ends of the spectrum. On one end, people are lacking facilities. On the other end, there is excess facilities which is giving rise to different kind of diseases. And the two main causes here are, of course, infrastructure, which is a poor doctor-patient ratio in India. And the second cause is primary care facilities we are lacking, of course. So government is taking a lot of initiatives here. In fact, our doctor-patient ratio is so low.
Dr. Ashish Pingle, just please hurry up.
Yes, sure. Our doctor-patient ratio is so low that it's the lowest amongst all BRICS nations at 13 doctors per 10,000 people. And second thing is, of course, lack of awareness. So lack of awareness leads to poor health compliance with medication, and people don't know how to take care of themselves. So the best way to attack NCDs is through technology, of course. So out of the almost 10 million deaths every year, we believe at least 53% of these deaths, almost 5.5 million of these deaths, can be attacked with technology. And NCDs can really, doctors can really revolutionize the treatment of NCDs just by using technology. So what is the solution? The solution, of course, is better compliance to medication, to lifestyle advice, on-time follow-ups where patients keep visiting you regularly as prescribed, and increase awareness about their own health and how to take care of their health and how to prevent these NCDs. So, we are proud to introduce a software which will really help you do this. It's the simplest way to go digital and get better health outcomes. So 3 important things. One is better outcomes because of digital medical records, automatic follow-up reminders so patients keep coming to you regularly as prescribed, timely medicine reminders. So imagine you prescribe a medicine and the patient gets a reminder every morning, afternoon, evening to take that drug. Won't it be so helpful for patients, to comply with the medication and get better faster? Second thing is building better relationships. So yesterday at a session, at a workshop, actually a doctor mentioned that diseases come and go, but people remain. So it's great. It's very important to maintain relationships and build relationships with your patients. So we have great communication touch points. You can reach out to them through SMS, email, digital lab reports, e-prescriptions, of course, make patients feel very confident that their health record is being documented digitally. And of course, better practice, more efficiency and more productivity at your practice by managing your whole calendar, by having tamper-proof digital billing, and of course, managing any in-house lab or in-house inventory of any medicines that you might have. So these are the 3 main important benefits that technology can give you today: better outcomes, better relationships, and of course, a better practice at the end of the day. So doctors can easily schedule appointments. You can print out a prescription and hand it over to the patient, or just SMS or email the prescription. You can check you can keep track of the revenue. Every month you get a report and you can check what is coming from, how are things going about, where you can improve. You can, of course, it's very easy just to simply go digital using your phone. You don't even need a computer. Just get the app and you can start it from day one. Once you're comfortable with the app, you can, of course, move to the computer for the great experience. So in the interest of time, actually, I won't give you an online demo, which I had scheduled, but we are outside. We have a stall outside. You can check out a demo yourself. And we are also running a small survey for doctors to understand their needs better. So please visit our stall and fill in our short survey. It'll just take you 2 minutes. And I'll just leave you with this message: that better outcomes, better relationships, and better practice. It's all easily achievable with technology. And you can just visit our stall outside to find out how. Okay, thank you.